Welcome back from Estonia's most comfortable seats right now. I've got with me the three speakers that had just given their short presentations to you. So thank you very much for being here with us. I have two questions for each of you that sort of connected to each other and that probably give the audience the best idea about how you work and what exactly you're looking for. So the two questions are, number one, what's your ideal client? Number two, how does the business model usually work for you? How would you like it to work for you? Maybe let's start with you, Liis.
Should I take both questions?
Yeah, just go for both. Take them all.
Thank you. Ideal customer. Our ideal customer actually is, for example, a large B2B event organizer. In UK, we currently are working with one 17,000 people event in July, for example. Smaller ones even before that. So we like to, yes, work with big volumes in that sense. So we are also on the B2C market, where people who actually need to travel, where they need to visit another country, they need the certificate. So they acquire it through our service. Mm-hmm. But ideally, we work with B2B customers.
All right. And about the sort of company, the business setup, yes. How does that work?
Our business model is such that we ourselves are not a medical service provider. We call ourselves technology rails for medical service providers. So be it the lab or a clinic, who basically outsources their testing service to us by thus expanding a lot their testing capabilities. And also the governments can expand their testing capabilities through our at-home certified, secure, trustable testing service.
All right. So you would be charging those end users
yes.
rather than the clients?
So we charge the end users through that model, yes.
All right. Great. Gomti, what about Viveo? How does it work for you? Number one, who's your ideal client if you could dream it all together, and how does the financing work?
For us, the ideal space would be anybody in insurance business. Like I said earlier, so if today, the way the insurance business is, it's not going to be profitable because consumers are going the digital way. There's a McKinsey report which has said that 80% of the consumers are today trying to convert their consultation from physical to digital. So in that case, we come in handy, and to the insurance companies, we already have experience of working with them in Estonia and elsewhere in the Baltics. So there's a clear case where by using us, and they can be much more efficient, and that has a direct impact on their profitability, the claims ratio, as well as things like important metrics like customer churn is reduced, customer satisfaction scores improve because you have ready access to a doctor through this service.
Very well. About the business model, could you tell us more there?
I think the business model is fairly simple. I mean, it could be an a la carte model where it could be on a transaction basis because the insurance companies don't mind spending on this because of the larger saving that they have over a period of time.
Yeah. Very well. Thank you so much. Ain, tell us more about Guardtime's ideal customer and how do you make it all work?
Right. So we are ecosystem facilitators, which means that we enable different participants to engage in new types of relationships by making the data available between themselves. Mm. So it really doesn't matter from which part of this ecosystem. Currently, when we talk about Vaccine Guard, it usually is an organization who is responsible for vaccination campaign. It can start from local municipality, or it can be a state or a country. It's very differently organized. Now we know that when the big concern is more or less over, that the first period where there was not enough vaccines, and now all those different organizations start to think, okay, COVID is not going to go away. There will be increasing number of adult vaccination campaigns that you need to organize. So I would say we start from the public authorities. However, on the other side, there are also, for instance, vaccine manufacturers who are interested in making certain that their vaccines are actually used through legitimate channels, and also if we can enable to collect anonymous kind of analytical feedback so that, well, as you know, vaccines are quite expensive to produce. They have short shelf life, so that if you can pre-plan your manufacturing based on the need, that is also something where they are interested in working with us. And in the end of the day, the business model is a subscription, so that if you are making use of that infrastructure, well, on a monthly basis, if it adds value to you, then you are a happy customer.
And there are a lot of margins still being left on the table, absolutely. So
By all means, yes.
Absolutely. One question that we've been talking about before this lovely panel as well, that I would maybe want to discuss right here in front of the cameras also, is if COVID would magically disappear tomorrow, what would happen to your businesses? Are they adaptable for that kind of stuff, or what would happen? Again, from right to left, perhaps. You're right, yes.
Right. So I would be really happy if COVID would just disappear, first of all. What it would mean for my business is that, as I mentioned in the pitch, we are not focused only on COVID. We definitely want to be the rails for certified home testing, be it in clinical trials, be it in other tests that are already available today, but what needs still medical supervision because there lacks the trust infrastructure to make sure that if you're supposed to do that test at home, how do we know that it's you, that the test is the test, that the person is the person, that you do the sample collection correctly, and so on? There have been a lot of interest from the anti-doping world, and I assume that the business will be there for quite some time.
So you're going to be calling for the Tokyo Olympics as well.
That has been on the table, yes. Okay. That has been. Yeah.
So stay tuned, everybody.
Yeah.
Gomti, what are your thoughts on this?
I think digital health is here to stay, Florian, I would say.
I hope so.
COVID actually accelerated it a lot, but I think it's here to stay. And the pointers are that, you know, it's much beyond what's happening currently, because the platform enables you to sort of tackle very, very serious health issues like chronic healthcare, diseases that require lifelong management like diabetes or like heart issues or women's health. And these, or dermatology, you don't need to really physically be in front of a doctor for all of these. And, you know, so the physical consultation can easily be on the digital platform, even post-COVID, and it's already trending that way for us. For us, it's not just COVID, it's already moved past that, you know, for us. And also things like the convenience, the affordability, the saving of time, increasing of, you know, the productivity, because now you can order everything like end-to-end on the platform. Your medicines can be ordered and delivered home. You don't need to step out of the pharmacy. Diagnostic tests can be had on the go, on the platform itself. People come, take up your samples, your results show up magically on the platform. So it's already happening, you know. So I don't think that this is here to stay, and I think this is positive for us.
I would certainly agree with that. Ain.
Yeah. Well, first, before COVID, we based our work on three kind of assumptions. First is that healthcare is and will remain fragmented. And we can see that actually the disruption enables to make healthcare more resilient by keeping it fragmented, which means that certain things happen at home, then you have a mobile phone with you. So that the second assumption is that, okay, even if different things happen in different locations, in the end of the day, there needs to be a single version of truth. Mm-hmm. So you need to bring together data from various sources, and then, well, be it certificate for travel or just your medical record in another location. And then the third part is that, okay, you still need to make all that privacy preserving and secure. So that those three assumptions haven't changed. So we are actually, through this Vaccine Guard, providing real-world data capabilities to maintain, well, this specific area, which is vaccination campaigns. But similarly, clinical trials need, you know, from the testing up to the point that you file your records to regulator, there are a lot of activities that need to tie together so that in the end of the day, whatever inference you make is reliable and trustworthy. So that, yes, I personally hope that this madness is over at some point of a time. I can, travel freely and not try to think that what kind of tests I need to make. I'm good. Certific is there, so that at least it has been made less inconvenient. But in the end of the day, probably other tests are much more pleasant to think of.
I would certainly hope so, yes. I very much encourage the audience to also take part in this, and please submit your own questions. In the meantime, I wanted to ask, especially this panel, one of the questions that I also asked the first panel. We have to bear in mind that we have a double-balanced panel here. Not only do we have a lovely gender balance, but we also have 2 Estonians living in Estonia and 2 immigrants, myself and Gomti, living in Estonia as well. So I think we have a lot of different perspectives here. If we think about one sort of part of the Estonian e-health system that we would want for the entire world, including the US and the Americas in general, what would that be? Ain, maybe you want to start.
Well, I'll start by saying it's possible. When I was the Undersecretary for E-Services and Innovation representing Estonia in Europe, that was the time right after the GDPR was passed. And then I said that, well, GDPR is not an obstacle, because Estonia has been living through flourishing digital services in healthcare and all other domains while following the same principles. Mm-hmm. So that I do think that the culture that you can protect privacy, but at the same time enable services that are actually cool, that people like, and that enable innovation. If people can kind of take this spirit with them, and then all this would be possible in other parts of the world, while the easier it would be for us to make business, because there are many like-minded people.
Yeah.
I would actually add to that, or play on the similar tune that we've been very active in UK now, and you see that the very often, even in the middle of the pandemic, where you would think that if people need solutions, they act fast, they think fast, they decide fast, and when you see that it doesn't happen, then it's like extremely frustrating. Mm-hmm. So. Yes, don't want to talk about specific like governments, non-governments, businesses. Don't want to go into this binary world, but still, it's. I would say that Estonia still has this lovely mindset, which I think Ain mentioned also, that we are still able to do quite fast decisions and bring solutions to life pretty fast, and it always starts by asking, I think, like, why not? Why should we not do this? And there's always obstacles, there's always hard things to solve, there's always issues, policy changes, whatnot. But if you always start by stating or reading the law of like, this can't be done, this can't be done, and this can't be done, so done, right? Easy, problem solved.
It's the pragmatism.
We don't need to deal with it. Then it's really hard.
That's very fair.
And it makes life for businesses extremely hard, who actually want to help and want to create new powerful solutions.
I think it's fair to say that everybody here on the stage is happy to help society as a whole, humanity as a whole. And I think this Estonian pragmatism that you sort of pointed to is still quite prevalent in this country. Yeah.
I hope.
Gomti, your impressions?
For me, I mean, it works like magic, because I mean, I could point out so many things, from electronic health records, or the way your taxpayers' money, you're actually getting the full worth for it, because this is something that we don't see back home, at least in many Asian markets and rest of the developing markets. But what strikes me and what's good for us is that it's not perfect. We see that just like she said, I mean, there is this wait period, for example, for a specialist doctor. And say you've been diagnosed with, say, for example, something like cancer, and you have to wait for chemotherapy for months. There's that time, and that's where Viveo Health comes in. We make sure that you have access to specialists really fast, because we have a good network of on-ground partner clinics, and so then your accessibility can become better. So it's not perfect, but it's much to admire and learn from, I think, for the rest of the world.
Yeah, absolutely. For me as a German, what was mind-boggling was the privacy aspect of things, and I think this also pertains to all of the things that you're doing. It's not just that the data is available to whomever we choose to make it available, but also that we can block it for those that we don't want to see the data. And I think this, while it was discussed that privacy is not such a major issue for the American market, it's still something to be taken into consideration. If we're looking at the amount of lawsuits that are being filed in the US, I can see several lawsuits already arise if digital data is somehow illegally obtained or copied or changed or anything like that. So this for me is quite impressive.
We work quite a bit with cybersecurity in our company also from the day one, and we do get the questions like, it's interesting, a young startup and already dealing with cybersecurity, and then we're like, huh? We're in health, like we can't get it wrong, right?
How can you think without cybersecurity?
Yeah, exactly. So it's hygiene and should be like designed from day one into the systems, but if you think only of that, then yes, a lot of obstacles may appear.
When you've had conversations with medical specialists, whether it's doctors or caretakers, with the patients as well, of course, have you had the impression that the openness to digital solutions and the digital literacy is similar across the different markets that you're looking at? And could this be an issue for the US as well? Or do we feel like that's a sort of humanity-wide question that we all approach reasonably similarly?
I think for us, at least, it's like healthcare for various like demographics. It's slightly different. Like the older demographic might not be so technologically savvy to download an app, for example. And we realized this when we were creating the solution, and so we made it really simple. So there is also a way by which it's browser-based, so you can just send a link, and it can be on a WhatsApp chat, or like it could be a message sent, and you just click it, and you're connected to the doctor. Voila, So even that's available. So one needs to think about the various age groups. Of course, people like us and the younger lot don't have such an issue, but I mean, I don't know about the other guys.
Yeah, I also think that this variation doesn't really go necessarily by countries. It is probably more by demographics. Luckily, I read that especially elderly people have been the group across the world who have discovered the benefits of digital services during this COVID time, because they were the ones who were most vulnerable. They were the ones who were afraid of. Now they realize you can talk to your children, you can talk to a doctor, you can have tests done, you can do many things. So
it's magical.
This is certainly something that will remain after this.
Unfortunately, COVID has forced them actually into this, right? But at the same time, it benefits them because now they have needed to learn the.
Well, you need certain incentive, and once again. I hope we have passed that phase, which was not that long time ago, when people came to Estonia, and the first question around security was that, is it safe? And I think now, when they start talking and finding what would be interesting, is the question has changed, how can it be done safely? So that I think this has really changed, and in most of the countries in the world, I haven't been to all the countries, but based on the discussions that we've had around 70 countries during this Vaccine Guard discussions, this if has been replaced with how, and I'm happy about it.
And the other thing is the rural markets, for example, like the data connectivity or the bandwidth, right? So which is why we have solutions like chat, which are less bandwidth consuming, not just like a video service, also multiple languages. That's been key, because not everyone speaks English, not everyone's got native languages. So I think being multilingual and local is key.
And we're not just talking about questions like data literacy, but also about literacy itself. When we think about some of the African countries, for example, literacy might be a question, but also mobile-first developments are very clearly a game changer for those countries. Whereas I think in the EU and probably also in the US market, it's a bit more stationary, if that's fair to say. Ain.
But actually, the digital tools are exactly the ones, if done and designed in the right manner, which can overcome this literacy problem. I think we all have seen, 2-3-year-old kids who can already interact with the screen, and also it has been demonstrated and proven that elderly people, if there is no mouse, but actually just a touch screen, it does not require many skills in order to start communicating. So that here the digital is really empowering.
Yeah, to create a more tangible world that makes it feel less like a service and more like a solution. I think that's what you're also all three trying to do.